Hello again, everyone. Edwin Learnard back once again. In this YouTube segment, I'm going to be giving you my coronavirus COVID-19 update for January 22nd, 2021. Now, anyway, as far as the world numbers go, according to worldometers.info, and this was updated January 22nd, 2021, looks like 2:38 p.m. GMT. The thing about this is total coronavirus cases over 98 million worldwide, deaths about 2.1 million, and the recovery, people that have recovered, which we don't always hear about. And I'm not saying people are oblivious to this, but we don't seem like we emphasize this enough. There's nearly 71 million people that have recovered from COVID-19, the coronavirus, as far as worldwide. So currently there's about 25.5 million active cases, and about 25 million, sadly, that are in, well, I should say nearly 25 million, this is actually good, nearly 25 million in mild condition, 99.6% in mild condition, only 0.4% in serious or critical condition, about 111,000 according to the data on worldometers.info. So anyway, so it seems like we are getting, there may be some light at the end of this very dark tunnel, and this gloomy tunnel, which has caused obviously a lot of sadness and despondency for others. And as far as the United States goes, this is data that was updated January 22nd, 2021, 7:48 a.m. Eastern Time. And that other time I gave you for worldometers.info, that was GMT time. NewYorkTimes.com has this updated for January 22nd, 2021, 7:48 a.m. Eastern Time. So we're approaching, for the United States total reported, it's closing in on 25 million. According to the data for January 21st, nearly 191,000 cases, over 4,000 deaths. So at least as far as the cases go, we're starting to it's starting to diminish. Over 14, the 14-day change reads minus 21%, droppage then of 21%, and then, however, as far as the deaths go, that is up plus 11% according to the 14-day change. Now, and we're just this is something that, again, we have to really be serious about and prudent and take our precautions, whether it be wearing the mask and social distancing. We can't be foolhardy and reckless and become even complacent if things look like we're starting to see data that looks more auspicious, and some people might become more relaxed and then start going outside and not wearing their mask. This is a thing that we have to continue to take seriously, and if we're diligent and we do this on a day-to-day consistent basis, we can certainly augment the chances of this going down dramatically. So it's something that we have to keep in mind. And the United States, sadly, has had over 400,000 deaths to date due to the coronavirus. And something I wanted to get at, it was something I saw on Cuomo Primetime last night, and there was some a lot of interesting information. It's a very good show to find out information, updates connected with the coronavirus. Now, on Cuomo Primetime last night, there was, again, very interesting pieces of information in a conversation between Chris Cuomo and Dr. Anthony Fauci. One item of discussion was pertaining to getting that second shot of Moderna or Pfizer following the first. Now, there may be some delay after getting the first shot, which might be a 6-week delay. Now, Dr. Fauci stated it would be taking a chance if they're waiting. People have to wait that long from the first shot they received. Hold on a moment, people. Sorry about that, I'm back. But anyway, now, and I guess, I mean, he's referring to the efficacy of having both shots in too long a time from each other. So he had stated that the second Moderna shot should be 28 days following the first, and he said with the Pfizer it would be 21. Now, Chris Cuomo, he brought up a good point, and I didn't even know really much about this until he stated this last night. Something about at the process in finding out information in terms of getting the vaccine could be, he didn't say these words, but I'm just kind of reiterating what he's stating. It would be arduous and painstaking. I mean, he was talking about, asking about how is this going to be facilitated, and it really needs to, I mean, that is a very good point, because he was talking about, going online and searching extensively, and you might get an appointment or something, and then maybe, then even that may not be, a guarantee. See, the thing is, and it just seems like there's a lot of, basically it seemed like what Chris Cuomo was stating about this, that there would be, it's a lot of legwork, a lot of channels you got to go through just to get to the point where you can even get that shot. And I'm just hoping that it'll be set up sometime in the near future when you go to your local doctor, and your primary care physician or what have you, that they will have these things available to them, so you don't have to go through such a laborious process in order to get these shots, perhaps. And I think that would seem like that would be the thing that needs to be emphasized. Now, another thing is that Chris Cuomo had also asked Dr. Anthony Fauci about what he felt in terms of the 100 million the plan that President Biden has for the United States, as far as the 100 million doses or shots in 100 days, and whether that was conceivable. Now, Dr. Fauci had simply answered. I don't think Fauci really gave an actual answer as to whether he thought that was realistic or not, or whether that bar was too high or too low. He said that the main thing, though, is that there was a plan that was formulated, and you had a plan to go with, and that was the main thing. Now, I'll give you an answer, what I believe on that. That would be pretty, I'd say, realistic, the 100 in 100 days, because you're talking about, 50, you have to really divide that 100 million by 2, 50 million as far as people in the United States receiving the shot. I don't know the exact population of the U.S. I think it's around 330 million, somewhere around there. So you're looking at about maybe 1/6 of the population getting the shot in the first 100 days, which of course is a little bit over 3 months. It's you don't want to necessarily put this bar too high, because if the expectation is so strong you don't meet it, then it's subject for more criticism later on. So to me, that seems like a realistic goal. But Chris Cuomo had actually stated, based on what we're getting in terms of the rate of these vaccine shots, that we could be looking into next year. I think he stated like February 2022 when all these vaccine shots would be completed, and that would not be, maybe not acceptable, but at the same time, if the rate is going to be accelerated gradually as the year progresses, these shots, I believe, will be completed should be by the end of 2021. So those are some things to look at as far as this go. And of course, we have these mutations and these strains of the coronavirus currently taking place now, and they were talking, I'm looking at something as far as coronavirus news, or something from the Wall Street Journal website, something about the South African coronavirus strain is there apparently, and talking about their concern over the immune response as far as triggered, it says something triggered by a COVID-19 infection or vaccination, and it says it might not be. Let me see if I'm reading this right. I'm sorry, I may not be reading this completely right. It says, quote, when I'm looking at in these Google search results on this, it says, quote, new research has increased worries that the immune response triggered by a COVID-19 infection or vaccination may be, they say, I'm sorry, may be less effective. And then I can't read really what it says after that, but so the concern is that it seems like it's the efficacy of this COVID, um, 19, vaccination. Um, see, the thing is, but anyway, on the positive note, it says here that Fauci says coronavirus infections may be plateauing. Um, and I don't know if he's talking about the United States or the world in general, but you can look that up online. I also look on, I would look up on that situation with the South African coronavirus, strain, regarding the worries perhaps about the immune response. So, um, anyway, people, that'll conclude this YouTube segment. Until next time, people, Edwin Learnard saying stay well.